The Australian Medical Association wants state and territory governments and public hospital administrators to improve the way they roster on medical staff. Now, joining me now is Will Milford. He's a doctor at Brisbane's Redcliffe Hospital. Will, how many hours would you work a week?
Somewhere between 40 and 50 hours is my usual working week. A lot of it depends on the rostering arrangements and things. Some weeks you'll work more, particularly if you're doing after hours sort of work rather than 9 till 5 sort of work. So it varies.
And that's pretty much the standard now for doctors?
Yeah, certainly it's getting a lot better. I think years ago it wasn't the standard. These days it is, and certainly in my career things have been generally pretty good. It's pretty rare that I work really long weeks, particularly without days off and things like that. Yeah.
So it has improved in the States?
Yeah, I think it has improved, and the audit shows that. It shows that the proportion of doctors in the higher risk categories has dropped from 78% to 53% now. So that's evidence of ongoing improvement. I mean, the extremes still exist, so there's still more work to be done.
But half of Australian doctors in Australia are still working those long hours without a break. And what's the danger regarding that?
So obviously the concern is fatigue, and fatigue impacts upon both patient safety but also doctors' physical and mental health and wellbeing.
Are patients' lives being put at risk?
I wouldn't say the patients' lives are being put at risk. Hospitals have well-established systems to safeguard against adverse events occurring to patients. Having said that, fatigue is probably one piece of a very large puzzle that does come into adverse outcomes for patients, and so it's something that can be addressed and can be improved.
So doctors are more likely to make mistakes?
Doctors are more likely to make mistakes when they're tired or fatigued. Okay, whether those mistakes result in adverse outcomes for patients and things like that is a different story, but yes, fatigue does adversely affect on us. I know I don't work as well, if I've been on for 14 or 18 hours. My problem solving isn't as good, my communication skills aren't as good. You get tired and you don't do your job as well as you could otherwise.
Doctors have been known for decades to work long hours. Now that the junior doctors are coming up through the ranks, there seems to be this new call for less hours. Are younger doctors just not willing to do what the older ones have always done?
I'm not sure it's a new call. I think doctors have always wanted to have a good work-life balance. I think you're right to a certain degree. I think junior doctors are less willing to accept the sacrifices that doctors did 20 or 30 years ago on their work-life balance, particularly in their personal lives. So I think there is a bit of a push from junior doctors for a better go, if you like.
Okay. And who needs to take responsibility for this? Is it a local level? Is it the federal level? Do we want regulated hours, or do we just want a better roster?
I think we just want a better roster. But having said that, it's got to be, all those bodies need to play a part. It has to come from both government and jurisdictional levels. Things like workforce expansion, improved rostering, changing the attitudes of older doctors, all will play a part to improve safe working hours for junior doctors.